you guys have ever watched either a parent or other loved one get old and just not be able to take care of themselves anymore, you know how hard it can be. But that is where these two come in, and thank you both for coming in.
Thank you.
We really appreciate you being here. We have Jason from Utah Senior Care Advisors, and then of course Erica from Mill Creek Home Health and Hospice. And Jason, you decided to bring Erica in because her company is really something that's close to your heart personally.
Well, you know, what my company does, Utah Senior Care Advisors, we provide a free service to help families find assisted livings for their loved ones, because there's a lot of different assisted livings out there, and they all offer different amenities and services, and a lot of times people will just call me and they just need help in their home with a loved one, need some home health or even end-of-life care, you know, for hospice. And I've worked with Mill Creek Home Health for years and years and years. The same care team that took care of my grandpa 10 years ago when he had Parkinson's actually took care of my grandma just over the winter when she was passing away. And so they just have retained such a great staff, and as they grow, they continue to get more and more great people to come on board with them, and they're just amazing. I mean, they're nurses, they're nurse practitioner, and they're physical therapists, everybody on their care team. They're in and out of every assisted living in the valley, so they're a great resource for me when I'm trying to find a reputable company to work with.
Very cool, and especially that's strong coming from someone like you who does know of so many different services and providers. So I want to ask Erica, though, what the difference is between home health and hospice, because two very different things, right?
They are two very different things, and it can get very complicated for families trying to navigate, do we need home health, do we need hospice? And that's really where we step in and work with Jason. People need the assistance to help figure out what's going to be the best solution for their loved one, and by working together and knowing people in the community that we can trust, that's how we can really make sure that people are well taken care of and that they're going to be successful at home.
So Erica, then at what point do you think maybe children of someone getting a little older should start thinking about this type of care for one of their parents?
When things are good, because when things are bad, it's really hard with all of the added stress if you have a mom that's fallen and broken a hip. So really having a plan as mom and dad get older, how are we going to help take care of them, and reach out to us ahead of time so that we can help you plan for that.
And that's not always easy to do, to go there emotionally, because that's something we don't really want to think about.
No, we don't. But I really encourage people, it's better to be in charge of the choices that you're going to make rather than being forced to make a choice you don't want to. So really empowering themselves as a family to have a plan for that.
Yeah, I absolutely love that. Jason, what do you feel like is the biggest challenge for families who are trying to find the right provider, the right home health, whatever it be, in navigating that?
Well, you know, assisted livings are tough, and it's the same with home health companies. I mean, they're a dime a dozen. They're easy to start up, and some of them are fly-by-night. And so to work with a company that's been around for years and years and years and is established in the community, I mean, they're one of the big ones, and they're a strong company. And so for me, it's great because I can ask them questions, you know, which assisted livings that you go into do you communicate well with? Which assisted livings have good pharmacies? Which companies do you not like to work with? So, you know,
that's
they're
so
just
good to know.
Yeah.
Definitely. And I didn't realize that they're all so different and that they offer different services. What are the specific services, Erica, that you guys do offer?
So we have a nurse practitioner by the name of Laura Chamberlain that works with us, and she's certified in palliative care, which really sets her apart from a lot of other providers. So dealing with patients that need pain management and things like that. We also provide in-home home health, which is having a nurse, a physical therapist, occupational therapist come to that resident or patient's place of living and provide the care there. So they don't even have to leave their home. We come to them. And with hospice, we're helping to provide comfort and dignity to people that are going through a really hard time. And so it's a blessing to do what we do.
Yeah, certainly. Well, Hearted is a beautiful thing to be able to have that resource. We should also mention Utah Senior Care Advisors does have a hotline that you guys can call if you ever need any help or just advice. That number is right there on your screen. And we're going to post all this information as well at goodforutah.com. Thank you both for coming in.
Thank you so much.
Really appreciate it. Okay, everybody, coming up next, we are in the kitchen with Reagan making the cutest little s'mores you've ever seen.
Well, they are so tiny.